In the heart of our bustling cities, an invisible menace can lurk where we least expect it. It's not in a dark alley, but in the refreshing mist from an office building's air conditioner, the steam of a hotel shower, or the gentle spray of a decorative fountain. This threat is a bacterium called Legionella pneumophila, the cause of Legionnaires' disease, a severe and sometimes fatal form of pneumonia. Today, we're diving into the world of urban epidemiology to uncover how public health detectives track this elusive pathogen through the concrete jungle and work tirelessly to protect millions from an enemy they can't even see. The story of Legionnaires' disease begins not in a pristine lab, but at a hotel in Philadelphia during the sweltering summer of 1976. The city was celebrating America's bicentennial, and thousands of members of the American Legion had gathered for their annual convention at the Bellevue Stratford Hotel. But within days, a mysterious illness swept through the attendees. High fevers, coughs, and severe pneumonia-like symptoms sent panic through the city. By the time it was over, the illness had claimed 29 lives among the Legionnaires, with 34 fatalities in total. For months, the cause was a complete medical mystery. It wasn't until early 1977 that a CDC microbiologist named Dr. Joseph McDade finally isolated a previously unknown bacterium from the lung tissue of a victim. In honor of the group it first afflicted, he named it Legionella pneumophila. The investigation eventually traced the source to the hotel's air conditioning system. The cooling towers on the roof had become a breeding ground for the bacteria, which then spread throughout the building as an invisible, contaminated aerosol. This landmark case gave a name to a new disease and revealed a public health threat hiding in plain sight within the engineered water systems of our modern world. It was a watershed moment, establishing the critical link between urban infrastructure and infectious disease. So why are our cities the perfect breeding ground for this bacteria? Legionella is naturally found in fresh water like lakes and streams, but usually in low numbers that don't pose a threat. The urban environment, however, creates a perfect storm of conditions that allow it to thrive. First, there's temperature. Legionella loves warm water, with an ideal growth range between 77 and 108 degrees Fahrenheit, or 25 to 42 degrees Celsius. This is a common temperature in large building plumbing, hot water tanks set too low, and especially in cooling towers. Second is stagnation. Parts of a water system with little or no flow, known as dead legs, allow water to sit in that ideal temperature range for long periods. This also allows disinfectant levels, like chlorine, to drop, creating a safe haven for bacteria. Finally, and most importantly, is biofilm. Legionella rarely just floats freely in the water. Instead, it thrives within biofilms, those slimy layers of microorganisms that stick to the inside of pipes, shower heads, and cooling tower basins. This biofilm provides both nutrients and a protective shield. Humans get sick not from drinking the water, but by inhaling tiny aerosolized droplets containing the bacteria. The primary culprits for creating these dangerous mists are cooling towers for large air conditioning systems, faucets and showers in big buildings, decorative fountains, hot tubs, and even some humidifiers. This makes densely populated cities, with their countless office towers, hospitals, and hotels, the primary battleground against Legionnaires' disease. When an outbreak is suspected, a team of public health officials, epidemiologists, and microbiologists springs into action. Their investigation is a meticulous process, a real-life detective story. Step 1 is to define the outbreak. This means setting clear criteria for who is considered a case based on symptoms, lab confirmation, and a specific time and location of exposure. For example, a case might be a person with lab-confirmed Legionnaires who lived in or visited a specific neighborhood within the 14-day incubation period before getting sick. At the same time, health departments alert local hospitals, urging them to test anyone with pneumonia for Legionella. Step 2 is the epidemiological hunt. Investigators conduct detailed interviews with each patient, using what they call trawling questionnaires. to map out every movement in the 2 weeks before their illness. Where did they live, work, shop, and travel? They are looking for a common thread, a single point of exposure. This is where spatial analysis becomes a powerful tool. By mapping the home and work locations of all the cases, investigators can identify geographic clusters. In a 2022 outbreak in Ontario, Canada, mapping revealed that cases clustered within a 6-kilometer radius of a specific community, helping to narrow down the search for the source. Step 3 is the environmental search. Guided by the maps and interviews, environmental health specialists hit the streets. They identify every potential source of aerosolized water in the suspected area: cooling towers, fountains, and large plumbing systems. They then collect samples. This isn't just scooping up water. They take large 1-liter water samples from places like cooling tower basins. But even more importantly, they take biofilm swabs from the surfaces of pipes, faucets, and shower heads, because that's where Legionella is most concentrated. Step 4 is the laboratory confirmation, finding the smoking gun. In the lab, samples are cultured to grow the bacteria. This confirms its presence and provides a physical isolate that can be used for molecular fingerprinting. To definitively link an environmental source to a sick patient, scientists compare the genetic makeup of the bacteria from the patient with the bacteria from the water samples. They use advanced methods like sequence-based typing, or SBT, which analyzes specific genes to assign a unique code. If the code from a patient matches the code from a cooling tower, that's strong evidence. Another method is pulsed field gel electrophoresis, or PFGE, which creates a distinct DNA fingerprint. But the gold standard today is whole genome sequencing, or WGS, which analyzes the entire genetic code for the highest possible resolution. A match with WGS is considered definitive proof. In the massive 2015 New York City outbreak, investigators used these techniques to test 55 cooling towers. They found a strain in one tower that was a perfect genetic match to the bacteria taken from 26 patients, confirming it as the source. Once the source is identified, the next phase is to halt the spread. For a contaminated cooling tower, this means an emergency shutdown and disinfection. A high concentration of chlorine is circulated through the system to kill the bacteria and break down the protective biofilm. Then, the entire system is drained, physically cleaned and refilled. In a hospital, it might mean restricting shower use and installing special 0.2 micron filters on faucets that are small enough to physically block the bacteria. But the best solution is long-term prevention. This is achieved through something called a Water Management Program, or WMP. These are now required for many large buildings, especially healthcare facilities. A WMP is a continuous, 7-step process. A team is formed to map out the building's entire water system. They identify all the high-risk areas where Legionella could grow. They then establish control measures, like keeping hot water consistently above 140 degrees Fahrenheit and ensuring disinfectant levels are always adequate. They continuously monitor these controls and have predetermined corrective actions for when things go wrong. Finally, they verify that the program is working, often through periodic testing. The 2015 New York City outbreak was a major catalyst for policy change. In its wake, New York became the first city to mandate the registration and regular inspection of all cooling towers, a crucial tool for faster investigation and prevention. Let's look at a few more case files to see these principles in action. During the Flint, Michigan water crisis, Genesee County experienced a major Legionnaires outbreak. The investigation was incredibly complex. Evidence pointed to the local hospital's plumbing system, but the city's improperly treated water, which lacked sufficient disinfectant, was a major contributing factor. It showed how a city-wide failure can create the perfect conditions for an outbreak. The 2015 South Bronx outbreak is a more classic example. A rapid investigation identified 138 cases. Epidemiologists mapped the cases to a geographic hot zone. Environmental teams sampled 55 cooling towers in that area, and genetic testing definitively linked a single tower to the outbreak. The immediate response was to decontaminate that tower, and the long-term response was the citywide cooling tower law. The threat is ongoing. In the summer of 2024, a cluster of Legionnaires' disease emerged in Harlem, New York City. Following the established protocol, the health department immediately began sampling cooling towers in the affected zip codes. Within days, they identified and ordered the remediation of at least 11 towers that tested positive for Legionella, showing how a rapid, well-rehearsed response framework can be deployed to protect the public. As long as our cities rely on complex, man-made water systems, the threat of Legionnaires' disease will remain. The work of urban epidemiologists is a continuous cycle of surveillance, investigation, and prevention. By combining classic shoe-leather detective work with advanced mapping and molecular science, they trace the invisible threads that connect a sick patient to a water tower miles away. Their efforts, coupled with robust prevention strategies like water management programs and proactive public policy, are our best defense against this persistent urban menace, working to ensure the air we breathe and the water that surrounds us is safe for everyone.